It's my pleasure to talk to you today about my adventures in YouTube. So social media, what I'm doing there. So let me just share my slides. And so I was invited to talk today about what I'm doing this platform. And I hope you're seeing the right screen there. Yes, thank you.
You betcha.
Great. So then what I'd like to talk today is a little bit about this great platform and what it can do in terms of education for us, for our patients, and I'll share a little bit of my adventure. So in terms of disclaimer, my YouTube channel is monetized and I receive payment every time that someone watches an ad in their YouTube from my videos. So a little bit about YouTube. It's owned by Google. If you don't know, they bought Google bought YouTube a couple of years ago. YouTube has 2 billion monthly active users. It's the second most searched platform after Google. It has 10,000 employees, and it's a platform that nurtures and pays the creators, opposite to other platforms that charge creators for posting content. In the past 3 years, YouTube paid more than $30 billion to creators all over the world. And there are 344,000 people who quit their jobs to become a full-time YouTube creator. Every minute, there are 500 hours of video uploaded on YouTube, every minute. So if you want to know how much YouTube is paying for each creator, there are many platforms. There's this one, socialblade.com, and you type your favorite YouTuber, and you will have an idea how much that YouTuber is being paid by YouTube. So I don't know if you saw this lady, Susan Washinsky. She is the CEO of YouTube. Actually, if you hear her story, Google was born in her garage. So the people who founded Google, they rented her garage and they started Google. And then when Google started growing, they hired her to be a project manager. She was the employee number 16 of Google. And she had an idea. She said, why don't we do a video platform? So they tried, Google created some video platforms, but when she heard about YouTube that was invented and created by a separate group, Google went there and they bought YouTube. I can't remember how many millions of dollars they paid for YouTube. And then the owners of Google looked at her and said, okay, it was your idea to buy this thing. Why don't you become the CEO? So she's the CEO of YouTube. Now, so every year I feel now that I am an employee of YouTube because I get paid by YouTube. So I need to know my CEO. You know, if you work for a hospital, you know your CEO and you know what are the plans for your hospital? What is the mission statement of your hospital. So I need to know a little bit more about this company that I'm working now. And she released a letter in January 2021. What are the priorities for YouTube for 2021? And if you see here, it's very interesting because one is she wants to grow the creator economy. They invest a lot on us. I feel that as a creator, I am nurtured. I know the policies. There are a lot of potential sources for making more money, and she supports all creators. I cannot tell you enough how I feel supported by YouTube. One of the priorities is regarding their social responsibility. So a big responsibility regarding vaccinations, health, and racial justice. Those are the 3 priorities to the society. And you see health here, I highlighted. She wants to help people learn new skills, which means that they want to grow the side of YouTube that is more for education. As you probably, if you ever watch at YouTube, you know that there are 2 camps, entertainment and education. She wants to make the education videos to give more space for education videos. So that's to learn new skills. She wants to build YouTube of the future, more mobile creation, commerce, and making it in the living room. So watching YouTube from your TV. And there is also the regulatory landscape that they talk. So if you want to hear the YouTube priorities, there is this document there. So two things that I highlighted from her letter, from her priorities. This is what she wrote. We want to help people understand the importance of vaccinations by connecting them with timely information to make informed decisions. They are very serious about misinformation on YouTube, and they remove it quickly. She also said, we are setting a new goal to double the number of users who engage with educational content on YouTube, instead of just growing the entertainment side of YouTube. So there are some research around YouTube. I found this paper. It's a review of YouTube as a source of information on fibromyalgia, education quality on YouTube videos on musculoskeletal ultrasound, assessment of the quality and reliability of the information rotator cuff repair on YouTube. YouTube has an information source for femoroacetabular impingement syndrome and systematic review of video content. So all of this analysis of the content of YouTube, they show one common thing. The quality of medical information is very low, very low. Low reliability, a lot of conflict of interest. It's interesting that I contacted these authors who did the fibromyalgia review, and I asked them, did you include my video on your systematic review? And they replied to me immediately. And they said, Dr. Furlan, your video on fibromyalgia was the highest ranked in our systematic review. So I was very happy. So this means that YouTube needs more scientists and healthcare professionals. They are craving for information. Susan wants to increase this side of the platform. There is a big incentive for health care information, high quality healthcare information on YouTube. And I can tell you, people are craving for this kind of information. This was my first YouTube video that I posted in February 2019. What is chronic pain? And why I opened this YouTube channel, Rob asked me yesterday in the wine and cheese, and I explained, it's because I explained this so many times to my patients. In my pain clinic, mostly what I do is education, explaining to them what they have. And this video here that takes 11 minutes, I repeat a lot in my clinic. And then I said, if I repeat so many times, I don't know if my patients are paying attention to what I say. I will put myself on YouTube, record myself, and this is where I record. This is my studio. This is my office at home, and this is where I record everything. Then I said, I'm going to put on YouTube. And you see, so far, this video, my first ever video, had 5,000 views. And I make all of my residents, medical students, they have to watch a playlist that I created for them, and they learn how I explain chronic pain to my patients. So my channel is my name, Dr. Andrea Furlan, and I talk about causes of pain, comorbidities, treatments for pain. I do a lot of demonstration of exercise. I'm a physiatrist, so I learn a lot about physical medicine and exercises. I talk about prevention. I talk about older population with pain, younger, and I love talking about nutrition, diets, and vitamins. And this is an analytics of my video. So you see, this is the last 365 days. I already posted 68 videos on my channel, and here, each box here is the videos that are being uploaded. So 2 videos in this week or this month. And so far, you see, this is the number of views. This graph is the number of views per day. So right now, since October started, I'm getting about 100,000 views per day. That's a lot. So far, 100.5 million views in the last 365 days. And of all my 185,000 subscribers, 183 were I gathered them in the last 365 days. So you see, a year ago, I was very unnoticed in YouTube. I was getting less than 1,000 views per day. I had less than 1,000 subscribers, and just exploded in the last year. And it's amazing. So the demographics of people who watch my YouTube channel, mostly women, majority are women. Here, the blue here means women and older. So this is the age group. A lot of my YouTube viewers are above 65. and women, which is the demographics of pain. This is interesting because these are the countries where these viewers come from. When I created this slide, I had 10 million viewers. Now I have 11.5. So majority from United States, and then India, Philippines, United Kingdom, Canada is the five country here, Malaysia. But even Russia, you see Russia here is, in terms of percentage, is low. It's 0.2%. But look at the number of views from Russia, 24,000 views from Russia. And I just got an email 2 weeks ago from the Russian Pain Society. They said, we watched your videos and a lot of people here in Russia like your videos. We would like to invite you to be a keynote speaker in November of their virtual conference. I wish it was in person, I could go to Moscow, but they invited me to give a talk on diet and pain because they saw my videos. So I'm going to speak in Russia in English, but in November at their annual scientific conference. And I think a lot is because I put closed captions in more than 36 languages in my videos. Even Russia, you know, Russia here is the 6th most used closed captions. And you see, it's more people watching than people that are in Russia. So there are a lot of Russians who are not living in Russia. They might be in other countries, but they are using the closed captions in Russian to understand what I say in my video. So 43,000 views using the closed caption in Russian. So I feel very privileged to be able to, for example, Hungarian and Vietnam and Greece, Romania, all these countries being, you know, there are people watching my videos and being able to understand what I speak because of these closed captions. This is my Blockbuster video. It's the longest one, 31 minutes. And I already got 3.1 million views on this video. It's about exercises and the comments. I love reading and responding to the comments. This is the second most common video, exercise for shoulder pain, and 2.3 million views on this one. And the comments are just amazing. People who are doing these exercises and getting better. And in terms of ranitidine, we're just talking about ranitidine. I mentioned ranitidine has a potential to protect the stomach from anti-inflammatories. And someone corrected me. They said, Dr. Furlan, did you know that ranitidine has been removed from the market? I did not know. So then I said, well, thank you very much. And so I learned from people who watch my videos, and I learned something about it. And this video was so nice because I did with Virginia McIntyre from Nova Scotia. We partnered, and she told me that she needed a video about how to teach people to set SMART goals. So we wrote the script together and I recorded, and I still get a lot of comments from people who are watching this video and being helped by setting goals and smarter goals. So what are the advantages and disadvantages of engaging in social media? Well, video, I can explain a lot more things in video than I can do in my clinic, because I can use special effects. I can write down, you know, the words that I'm talking. I think it's an effective knowledge transfer tool. They can watch on demand at home. It's free to them, although they are watching the ads and YouTube is being paid and I'm being paid, but for them, they don't need to pay anything. It has a global reach, and it's removing language and socioeconomic barriers. It's unbelievable the amount of people who contact me from Africa, Asia, Latin America, and they say, you are the only source that I have to manage my pain, because I have no resources to pay a physiotherapist or any other type of exercise. So I'm doing your exercise, I'm getting better. So I feel so privileged to be able to do this in distant countries. And it's advantages. I get paid so that I can invest in a nice camera. I can pay my editor to edit my movies, my videos, and pay someone to post on social media for me. Disadvantages, there is a huge learning curve to do YouTube. It's not easy. I'm registered now in a school. I'm paying a school. It's in the US. It's a virtual school, but I have to learn how to do this well. And I feel sometimes alone because it's a solo entrepreneurship. I have to invest in a good camera, microphone, although I use my iPhone, but I had to invest in microphone, in settings. You have to research your topics very well. You have to be consistent in uploading videos, and it takes time to see the results. I started posting in 2019, and I didn't start seeing the results until early 2021. So that talks about peer passion and mission, and time to connect with my viewers, answering comments and emails. I get a lot of emails, people who don't have a paying doctor, they send me information by email, and I tell them, sorry, I cannot be your doctor by email. I got the Silver Plate award in June when I reached 100,000 subscribers, so that was really nice. And how do I see the future of this channel? I plan to keep posting one video per week, to listen to my subscribers, to be relevant to them, to be helpful, to be evidence-based, and to be humble, because I'm learning more than I'm teaching every time that I research a topic. So thank you very much. This is my channel, and thank you for the opportunity to talk to you today.